psychologist aiming to make your life just a bit more manageable. Remember, the tools and the tidbits that you pick up on this channel are purely educational. They can't replace therapy, but with some practice, they can help you along in your daily life. So let's get started. Today is part one of a two-part video that I've been meaning to do for a while now, and I'm doing it now. It's going to be about therapy, the process of therapy, what it's like, myths versus truths, and what you can expect if you go to therapy, the process to be. So in today's video, it's going to be the myths versus truths part. There's a lot of misconception out there about people who haven't gone to therapy or have only seen therapy in movies or TVs or heard about it from friends. People can sometimes get a misconception of what it is and what it isn't. And I wanted to clarify ones that I've been asked or I've heard of in society where I sort of turn my head and I'm like, well, that's not how it goes, or that's not how it is, or even things that you see in movies or TV are pretty inaccurate. I think a lot of people have destigmatized therapy. It's not as seen as secretive or as like, oh, something's wrong with you if you're going. I think over time, mental health has been seen as something really important to take care of. I always say it's like going to the gym, but for your mind, right? It's good for you, it's good for everyone else. It's kind of like staying in shape in your mind and with your emotions. And it wasn't always like that, right? When somebody went to therapy, they saw it as not that necessarily bad, but something is wrong and you're going to fix it. Now, sometimes it's like that. Sometimes it's for a specific issue, but a lot of people go to therapy now. It doesn't have that stigma around it to gain insight and to learn things. And so I wanted to do this two-part video from a therapist to you guys. If you're thinking about going, or you want a friend or a loved one to go and you really want to know, well, what would it be like? I only know it from movies and TV, or I only know from this. These two videos are for you, and I hope it helps debunk a lot of things. So today we are going to do myths versus truths. The things that are out there in the ether and people say versus the actual reality. I mean, to this day, if I am talking to someone new and they say to me, what do you do? And I say I'm a psychologist, guess what the number one response is? Oh, are you reading my mind right now? So, that being said, besides me not being a mind reader at all, we are going to debunk other myths right now and really try to understand what it is and what it isn't. So I wrote down some myths that I've heard about throughout my life or from other people, and so I'm going to be reading them off of my computer and saying what the reality actually is. Okay, so let's start. Let's see. The first myth is, you lie down on a couch as a therapist listens to you talk. I mean, in the olden days, it was like that, that maybe you can lay down on the couch in the days of, Freud and all of that. And in certain branches of psychology, maybe that gives itself more to laying down on a couch. But most of the time, people don't lay down. They could, I guess. And most of the time when I see people, I am seeing them on a couch, but it's only to like spread out and sit however you want to sit and put your stuff down. Most of the time it's either a very comfy chair or it's a couch, but almost always, 99% of the time, I would say people just sit upright and we have a conversation. So that's the first one. The second myth I have is a therapist writes notes the whole session on a notepad as you're talking. They write or they're doodling. I mean, I can't blame people for thinking this. This is what we see on TV, right? Somebody sits and the therapist's like, and writing notes. I do take notes one time and one time only when I'm with a patient or a client. And that is in the very, very first, what we call initial consultation. When they come in to see me for the very first time, I'm not providing any therapy in that session. I'm trying to get an understanding of who they are and why they're there in that session so that things don't fall out of my brain and I need to keep all this information that they're telling me for the very first time. I'm writing everything down so I don't forget. So in that session, yes, every other session I don't ever write during session, and I would say most therapists don't write during session either. Okay, myth number 3. Therapists mostly respond with, I'm sure you could fill in the blank, how do you feel about that? Right? Again, can't blame you guys. That's what they show on TV. But I would say that's sometimes we genuinely want to know how the person feels about something or what their reaction was to it. And we might say, how do you feel about that? But that is not not the only jargon we use. Again, if we're trying to find something out, but most of it is not. How do you feel about that? And it's not even a question answer kind of thing. It's more of a conversation. It's more just of a back and forth, trying to understand things or talk about things or process, or a therapist teaching something. It's not just them saying something and the therapist saying, how do you feel about that? Okay, myth number 4. Therapy isn't affordable. I hear a lot of people say this, and they say this because the truth is a lot of psychologists and a lot of practices have moved away from taking insurance. And in a couple of minutes, I'll tell you guys why. So yes, when therapists don't take insurance, yes, it is more expensive for sure, and it can get to places that is not affordable for a lot of people. But that's not the only therapy available. There are many, many therapists and many practices that do take insurance, and there are also clinics with what we call sliding scales. So basically your scale is slid down of how much you have to pay depending on how much you make, depending on how much you can afford, so that it can attend to all different kinds of communities, not just those who can afford to pay without insurance. So you have many options: clinics, insurance, and of course, yes, there are ones that don't accept insurance. Okay, let's keep going. What is the next myth? The next myth is you are going to be forced or manipulated into talking about things that you don't want to, right? I understand why people think that, right? They're sitting in front of a stranger and it's like, what are they going to make me talk about? We are very interested in progressing you forward. Whatever you said was you wanted to explore or whatever you needed our help with, we want to move the therapy along and be helpful. Not to force you into things, but to more for you to feel better or for you to get insight, for you to achieve the goal that you came to us to achieve, so that we don't feel like we're wasting your time, right? And you're actually progressing forward. That being said, you are never going to be forced or manipulated to talk about things, because ultimately we want to have a good relationship. We don't want you to be uncomfortable ever. In fact, we want to make you as comfortable and as happy as possible. So we want to make you comfy and get to places where you're open to talking about things, so we can sort of move it along and help you feel better, but never by force, right? So if you say, I don't want to talk about that, we might ask, why don't you want to talk about that, and have that conversation, but never like, manipulation to get you to talk about things. No, it's your session, and what you do with that time is completely yours. Okay, the very last myth that I have here is oh no, it's not the very last, I lied. The next myth is you can go for a few sessions and feel better, or you need to be there for years. I've heard both extremes, right? I'm just gonna go for a few sessions and it's going to help whatever it is, or I'm going to figure this out, or if I get into therapy, my God, like I'm gonna be there for 5 years or 10 years. Those are both extremes, and the truth lies somewhere in the middle. Usually when I see somebody, whether they're a child, teenager, or adult, it's at least for months at a time. And yes, sometimes it is for a year or 2 years. Typically at the 2-year mark, it's because they really enjoy it and they want to stay. Not necessarily because they have to. By that point, we usually have made some good progress, even by a year mark. So You don't have to be in there for 5 or 10 years if you don't want to. I would not say that is typical, although it does happen. And certainly a few sessions will probably not do much, right? So back to the insurance thing that I was talking about, why a lot of therapists have moved away from insurance is because a while back, insurance had this thing where they would say, oh, this person's diagnosed with anxiety. Okay, well, anxiety should take 8 sessions to cure and to beat, and then they should be on their merry way, so they would only pay for 8 sessions. There were those kind of stipulations. So doctors were like, that's ridiculous. People are human beings. They're not computers. It's very complex, and there is no golden number. And the golden number certainly isn't 8 and done. So yes, it's typically not a few sessions or a handful of sessions, and it's typically not years and years and years. It's something between months, a year, 2 years is where, for me, I see most of my patients in that time frame. Okay, let's keep going. See, I was right all along. That was the very last myth. If you have any other myths that you've heard of that you would like either confirmed or debunked, you can put it down in the comments. These are just the ones that came off the top of my head that I've heard most often. But again, if you have other ones, then please comment down below and I could reply to your comment with a response, either debunking it or confirming it. But I hope this was helpful. Any experience that we have not a lot of expertise in or not a lot of experience in, you feel a little nervous about, which I completely understand. So I was hoping that this would be kind of pulling back the curtain on what therapy is and hopefully showing you that it's not so scary and it's not so mysterious and it's certainly not forced or rigid. A lot of it is about the relationship and what you make of it. That I will talk about in the next video. In the next video, I will take you through why going to therapy should even be an option, why you wouldn't go to your family or friends, and I will take you through the process. What does it look like to go to therapy? What happens in the first session? What happens after that? Again, all of this is from my framework. I'm a cognitive behavioral therapist. There are other branches, but we'll talk about that in the next video, okay? I hope this was helpful. I can't wait to see you for part 2. And if you have any comments or questions about the myth versus truth, just comment down below. Until then, you got this. See you next time.